Yes.
Hi, how are you doing today?
Good, how are you?
I'm good. So my name is Lauren Daly. I'm a first-year medical student here at FAU. I'm going to be conducting the pulmonary and thorax exams today. Could I get your name and age?
Mary Anthony, I'm 19.
All right, and do you have a gender that you prefer to identify by?
Female.
Female. All right, before we begin, do you need a chaperone? Do you need a translator?
No.
And are you comfortable with the lighting and the temperature within the room?
Yes.
All right, and do you have any time constraints for the day?
No.
Okay, so this exam is going to take about 5 to 10 minutes, depending on how quickly I move. But this is going to involve a little bit of draping here. Because you have a sports bra on today, we're just going to be able to lower it entirely. But if you were wearing a normal bra or were completely undressed as a regular physical exam, we would have to do asymmetric draping, so we would only expose one side of the chest at a time. Are you comfortable with that?
Yeah, fine.
All right, good. So I'm just going to drape this a little bit so that we can see the full point of the chest. Upon initial inspection, I see no scars, erythema, swelling, bumps, lumps, or bruises of any kind. It appears normal. I'm just going to go ahead and tuck your hair back behind you, and I'm just going to palpate along the apical portions of the lungs and down the sternum, skipping over that area a little bit underneath, up to the lateral portion of the chest. And because this is also a thorax exam, I would normally be inspecting and palpating your axilla and your breasts, but we're not going to do that today. I'm going to just palpate the other side of the chest now as well, noting any tenderness. No? No pain? I'm not too annoying? All right, good. All right. So after inspection and palpation, we move on to percussion. So I'm just going to make a little bit of tapping motion just to kind of hear things, how it's going on in your lungs, just to kind of see if there's any lesions or fluid within there, okay? So you're going to tap along the apex, from the front of the chest, bilaterally. And then could I just have you lift your left arm up a little bit for me? Lift it up that way. Here we go. You're going to percuss along the lateral aspects of the chest as well. And then just go lift this one up as well. All right, seems clear there. And I'm just going to go ahead and give it a listen. As I place the diaphragm portion of my stethoscope on your chest, I'm just going to have you take big, deep breaths out of your mouth, okay? So open mouth, big, deep breaths. If your patient has very small clavicles, you can flip it over to the bell side of your stethoscope, but diaphragm works as well. So big, deep breaths. Go ahead and lift your left arm up for me. Deep breath in. All right, go ahead, and then this arm as well. Very good. All right, so there are no specific movements of palpation or auscultation for the front, so we're just going to move to the back now. Do you need to step off the chair? Yeah. We're going to drape you up again, because obviously we're done with that, and we want to make sure you're as comfortable as possible. And I'm just going to move your hair so I can get full vision of your back. All right. Upon inspection of the back, I note no erythema, no scars, no bumps, lumps, or bruises as well. Everything appears healthy and normal skin. For this portion of the exam, a lot of the time when you're auscultating or percussing, you're going to want to have the patients cross their arms against their chest so that you can move the scapula out of the way and you're ensuring that you're listening to the actual lungs. But for first palpation, I'm going to be feeling along the top of the back, along the midline aspects, noting any tenderness, all the way down around to the lateral aspects of the chest. And for chest expansion, I'm going to place my thumbs towards the midline of the back, wrap my hands around, and ask the patient, just take a deep breath for me. And another deep breath. Noting the separation of my thumbs for good chest expansion. All right, so I'm going to perform something now called tactile fremitus. So I'm going to put the base of my hand here against your chest, and every time I place them, I want you to say, nice and strong, nice and loud, 99. All right? All right.
99, 99, 99.
Very good. So the vibrations within that all seemed symmetric and normal. I didn't note any fluid or diminished vibrations that would indicate fluid or any masses within the lungs. All right, so I'm also going to be performing percussion now, so the same tapping motion in 3 places along the spine. Go ahead and cross your shoulders for me. Perfect. I'm just going to reach a little bit under your sports bra so they can get to the skin. And then again on the right side. All right, very good. And then finally, I'm just going to give them a listen once more. Go ahead and cross your arms again for me. And remember, when I place my stethoscope, big deep breaths out of your mouth, okay?
Okay. Side to side.
Hold on, sorry.
Compare side to side.
Okay. This way you can jump cut. Lungs are cleared by auscultation bilaterally. So just go ahead and fully drape you again. Do you have any other questions for me?